June 2022. On today's panel, we have the Honorable Minister of Health, as well as the Chief Medical Officer, Dr. Roshan Parashram. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and I will moderate today's virtual media conference. We begin with Dr. Parashram, our CMO, who will present the latest clinical update and as well update us on the latest Omicron subvariant that is present in Trinidad and Tobago.
Hi, good morning. Thank you, Al. Good morning to the Honourable Minister. Good morning to members of the media and members of the viewing and listening public. So if I could have the dashboard for July 19th, 2022, please. So that is update number 1,155. Fully vaccinated population, 51.1%. The Honourable Minister will give further details. New positive cases over the last 24 hours, 201. We are reporting no deaths during that period as well. Total patients hospitalized, 99. Total active positive cases in the community, 6,048. Patients' vaccination status in terms of deaths and as well as hospitalization remain more or less the same as it was last week in terms of percentages. As it relates to the breakdown in hospital, we look at the 99 persons. In terms of Couva Hospital and Multi-Training Facility, 39 of those. 2 persons in ICU, 3 in the high dependency unit. Cora 11, Augustus Long 23, St. Anne Hospital no one at this time, Arima General Hospital 6 persons, St. James Medical Complex 7, Scarborough Regional Hospital Fort King George 11, and Scarborough General Hospital we have 2 persons. In terms of the monkeypox situation, in terms of global update, this morning there was an ongoing briefing from WHO, July 20th, which suggests that just under 14,000 cases confirmed, that is from January 1st to present, in over 70 countries. I think we would have reported just over 50 countries on last week's update. There are 5 deaths, all within the African continent. And in terms of their meeting, which was scheduled for the week of the 18th, it was announced that that meeting should take place on July 21st, which is tomorrow. If I could have the first slide of the Omicron presentation, thanks. Right, so we're going to speak a little bit about, go forward, the Omicron variant of concern and its descendant lineages. So the first slide describes some of the characteristics of variants of concern. Generally speaking, any virus mutates significantly, and the COVID-19 virus has been no different, having hundreds of mutations occurring over the period of the pandemic. What makes something a variant of concern is certain characteristics. And if you notice at the end of each sentence there's an or, so as I go through you will see or. So it means that any of these can make something a variant of concern. Bearing in mind there have only been 5 designated variants of concern over the entire pandemic thus far. So a variant of concern is associated with one or more of the following traits at a degree of public health significance. So it spreads more easily, or it causes more severe disease. Next slide. It may escape the body's immune system. It may present clinical presentations which are different or concerning in terms of the outcome. And it may decrease the effectiveness of tools such as public health measures, diagnostics, as well as treatment or vaccines. So those are the main characteristics that define a variant of concern. As it relates to a previous variant of concern that was circulating before, that is a variant of concern that was already in circulation and now is circulating at a very low level and has demonstrated that it no longer poses a major added risk to the global public health compared to other circulating variants. So this table will depict our previously circulating variants of concern. And as I said, there were 4 plus the Omicron, so Alpha, Beta, Gamma, and Delta. I won't go into the details of those. If we go to the next slide, we'll spend a little time now with the variant of concern that remains the dominant variant circulating globally, so Omicron. On the 26th of November 2021, WHO designated Omicron B11529 a variant of concern. Since its designation, the original Omicron virus has evolved and given rise to many descendant lineages with different mutations. Next slide. So it comprises BA1 to BA5 sublineages, which are further divided into additional sublineages, including recombinants like XE, which is a combination of BA1 and BA2. The following subvariants have been prioritized for monitoring. Go to the next slide. We see a number of subvariants that have been categorized by WHO for monitoring, and we see on the left BA4, BA5, and a number of BA2 variants going down, BA2.75 in the latest in the line of subvariants, which is India, May 2022. Next slide. The number of confirmed global cases increased for the 5th consecutive week, over 5.7 million new cases reported during the week 4th to the 10th of July, and subvariants like BA4 and BA5 are currently driving waves of cases globally, BA5 in Canada and in the USA. So as of July 10th, next slide please, BA2 and BA2.1.12 and 1 have been shown descending trends globally, while BA4 and BA5 have shown increasing trends. Basically, what you're seeing is that BA4 and BA5, if you could go forward with the next slide, BA4 and BA5 have now become the dominant variants across most regions of the world, and BA5 has now been detected in 89 countries, including Trinidad and Tobago, and BA4 as well detected in Trinidad and Tobago. So we see that BA5 is now having a competitive advantage even over BA4. At least it seems so in the early days, where BA5 is outcompeting BA4 and BA2. Next slide. So therefore, we can state that BA5 is possibly the most transmissible SARS-CoV variant thus far. There's no evidence yet that BA5 is more severe, which is a good signal in terms of clinical outcome, meaning that it's more transmissible, but is not more dangerous in terms of causing more deaths or causing more hospitalizations, at least at this early stage. BA2.75 seems to have a growth advantage over BA5, but more data is required to verify this fact. Next slide. So this slide is just to highlight what I said before. So we would have had BA1, BA2, BA4, and BA5, and just some general characteristics. I won't go into all of them, but for BA5, growth advantage over BA2, and current data does not suggest a difference in severity of disease outcome. So this brings me, if you could go forward, the last slide. So the last slide gives an update of what we have circulating in Trinidad and Tobago, which is very important. So to date, Omicron continues to be the dominant variant of concern in Trinidad. A couple of weeks ago, we would have had in our sequencing one Delta as well. So there seems to be a very low presence of Delta in circulation, at least detected in Trinidad. BA2 of the Omicron sublineages remains the dominant for now at 45.5% of the samples that were recently taken. BA4 was detected prior to BA5, but only accounts for 9.1% of the recent Omicron samples. And as we said, BA5 seems to be the most infectious of the lot and was detected in 41% of last week's sample, noting that it was just first detected only a week prior to that. So it seems to be gaining speed and overtaking BA2 and BA4 in terms of the national picture and the international picture very quickly. And we keep an eye on and will update the population as it progresses. So thanks, Al, for the brief time this morning.
Thank you very much, CMO. We now hand you over to the Honorable Minister of Health, who will present the latest vaccination figures and an update on other COVID-19 related matters. Minister.
Thank you very much, Al. Good morning to the Chief Medical Officer and to our colleagues in the media. Good morning, and very good morning to all those listening and viewing in. So our vaccination numbers continue to be very low. Total first doses administered yesterday was 56. And the total doses in all, first doses, second, and boosters, are 121. We have now vaccinated completely 715,015 persons. So we are still stuck at 51.1% of the population. 166,895 have been boosted. And at this point in time, I really want to make a plea to those who have been vaccinated to get boosted. Why? Because the protection that you get from either vaccination or from any other source is going to wane over time. So the simple message is this morning, if you are not vaccinated, get vaccinated. Get that immunity that you require. And if you are vaccinated, your protection is going to wane over time. So we urge you, if you are vaccinated, especially if you belong to one of the vulnerable groups, the elderly, those with comorbidities, non-communicable diseases like diabetes, hypertension, so on, cancers, dialysis patients. If you are obese, overweight, the pregnant population, if you are asthmatic, you suffer from cardiac issues, you need to protect yourself by either starting the vaccination program, or if you have already been vaccinated, get boosted. It can really help save your life and keep our hospital numbers down where they have been. Make sure our ambulance services don't have to respond as they used to have to respond to COVID cases, so the non-COVID cases can get that sort of priority. So it's a very simple message this morning. Our booster program needs a boost from you, the members of the public, going out there to be boosted. And finally, if you have not been vaccinated, please commit to being vaccinated. Thank you very much, Al.
Thank you very much, Minister. Next up is our question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask your questions one right after the other to the relevant members of the panel. We will take 1 question at a time, and we will start this morning with Newsday.
The panel, this is Paula Lindo from the Newsday.
Please ask your
Are you hearing me?
one right after loud and clear to the relevant members of the panel.
Okay, great, thank you. So the first question is to Minister Dialsing.
We will start this morning.
Just asked us to get boosted, and I wanted to find out: have we moved into getting second booster shots for the general population? I know we had said for the elderly, immunocompromised, certain populations could get their second booster, but can the general population get it now? And,
yes, that is the case. Thank you for asking, so we could reiterate it. As I said, anybody who has been vaccinated, please get boosted. The only population that cannot be boosted, and CMO, please correct me if I'm going off here, is that 12 to 18 cohort who got Pfizer. They could only have been boosted with Pfizer, but anybody over 18 can be boosted with J&J and Sinopharm, which we have in stock. So again, regardless of your immunocompromised state, but we are urging those who are at higher risk to get boosted, but we also urge anyone who has been vaccinated over 18 to get boosted. Thank you very much, Paula.
Paula, did you have a second question?
Yes, I did, but I also wanted to just clarify again, because I got my first booster in January of this year. Is it that I can go and get a second one? And my second question was not so much to do with COVID, but the Prime Minister has specified a couple times that he wants crime to be treated as a public health emergency. What does that mean for the health ministry? Thank you.
So if you got your first booster in January, as we recommended, you can get your second booster 4 to 6 months after. So you are well within that time frame. On the issue of crime as a public health emergency, first of all, we must recognize the intelligence of the Prime Minister's position in doing that. And as you would have heard on Monday at the press conference, he has appointed 2 co-chairs, which are permanent secretaries, and we will be supporting the permanent secretaries in developing the position that the Honorable Prime Minister wants. both the Ministry of Health and Ministry of Social Development and Family Services.
Thank you very much, Minister. And with that, we go to CL Communications. We are ready for your questions. Good morning. Ms. Thomas, are you there? Okay, she seems to be having some technical difficulties, so we go to Mr. Fleming. Good morning. Guardian?
Good morning.
Good morning.
Hi, good morning. Kevin Feldman from Guardian Media. CMO, I wanted to find out if we have been seeing a lot of COVID-19 reinfections, and if so, is it because of variants, or do the new Omicron subvariants have the ability to reinfect people within a short time? And to Minister Diasing, how likely are we to see Trinidad and Tobago reaching the WHO target of vaccinating 70% of our population?
Okay, so I'll take the second question first. So WHO advised countries last year that they should achieve, I think, a 40% of the population being vaccinated by the end of 2021. We reached that 40% threshold in September of last year. Right now, as we are at 51.1%, we continue to urge everybody to get vaccinated who are eligible to be vaccinated. We continue to watch the figures, but it seems that 49.9% of the population has made up their minds, but we continue to provide the information. We are here today again. We have not stopped the press conferences. We continue to engage people at the level of the RHAs. We continue to engage people at the level of outreaches. 109 health centers are open. The Ministry of Health's website is full of reliable information, not misinformation. And so we urge people to simply get vaccinated. And hopefully the rates can increase. It is difficult to set targets now. I don't think any country is setting targets again because as the pandemic drags on for 2.5 years, people are tired. I said, I understand that. But we continue to urge people so we can move past 51.1%.
Thank you very much. CMO?
Yeah, so some of the hallmarks of the Omicron variant, as I described in the presentation, is really one of reinfection. So it can reinfect persons. Persons can be infected more than once with it. So it is something very difficult to quantify in terms of the actual number of persons, especially if you have mild disease, post-up initial infection, you don't have people presenting and all of that. So in terms of quantifying, we haven't quantified a particular percentage that has been reinfected, if you want to call it. But generally speaking, a lot of the newer variants of concern have been prone to reinfection. And that is why I think Minister would have stressed on the booster program and the importance of boostering. Another element of people being reinfected, of course, is waning immunity over time. And most of these studies have suggested that after your primary series, that a booster should be had after 6 months. And then after your first booster, especially for vulnerables, you go 4 to 6 months and you have a second booster. So the booster program is extremely important. May not completely prevent infection, but certainly it will prevent severe disease outcomes in terms of morbidity and mortality related to it. So again, Omicron, one of the hallmarks is reinfection, but the best way to protect yourself, of course, is continue the 3 Ws and be vaccinated and boosted as soon as you can.
Thank you very much, CMO. We go to Renessa Cutting, TV6. Good morning.
Hi, good morning. With regard to the demographic, which has to be boosted with Pfizer, and for the persons who may prefer to be boosted with Pfizer, is it that the government is seeking to purchase these vaccines privately? And also, by chance, the few persons who would have had adverse reactions, could we have any status update on these persons to date?
Yeah, so we are always in the market for vaccines. So for the adult population over 18, the the booster program is there for you with either Sinopharm or J&J. I had indicated back in February, I believe, when we got in those 75,000 doses of Pfizer, I urged the population, I begged, I implored, I really went, all of us went out of our way to tell people these doses are going to expire on June 30th. And don't waste time if Pfizer is your preferred vaccine, especially for the 12 to 18. People have made up their minds. Some took advantage of it, some didn't. So it is difficult to go out and procure vaccines now in a stream that is no longer available to us because we did not demonstrate, and these were the words I used, we must have the appetite to show that we can use these vaccines. So Pfizer vaccines, we will continue to look and see if we can get supplies, right? But I did urge, I did ask the population, I did advise the population that these are going to expire on June 30th. So take advantage of it. And our tagline was, don't delay, vaccinate today. People have chosen to delay. So the 12 to 18 booster program cannot continue at this time, but for the 18 and over, we do have J&J and Sinopharm, which are perfectly safe to be boosted with.
Thank you very much. And with that, we go to CL Communications for your questions. That we go to CL Communications for your questions, please.
Yes, Yolande Thomas from CL Communications. Minister, the other thing is, I just wanted to ask you if the mask wearing, are you satisfied with the mask wearing at the health facilities, as well as the recommendations for churches and supermarkets?
So I am quite pleased. So let's go back. It's not a matter of being satisfied at the facilities. They are mandatory at healthcare facilities. So nothing has changed from Saturday to now. So mask wearing is mandatory in facilities. What we noticed, and I haven't been to churches yet, to be honest, but what we did notice in the public domain and streets, malls, supermarkets, that a lot of people wisely are masking. And for that, Yolande, I want to congratulate the population and thank them. It seems that the vast majority, as we always said, are really, really intelligent and taking the approach, managing their personal risk, as we have outlined, and that is on the Ministry of Health's website, that they are doing the right things. You will have the odd person, making comments about masks, and that is fine. But it seems in the public domain, the vast majority of people are really taking this thing seriously, and we are quite pleased that the masking has not been ditched wholesale, but people continue to be very, very responsible. And I really thank Trinidad and Tobago for that. I'm really, really grateful for that.
Thank you very much, Minister. We go to azpnews.com for your questions. Good morning.
Good morning, Suan Wayo from AZP News. And my two questions, are for the Minister. Could you clarify, perhaps, with regards to the Pfizer vaccines? Remember, we were supposed to get Pfizer vaccines from the US, and they were supposed to come in about 3 tranches. I believe we received 2. Given the current response from our population towards that, will we be actively seeking to get that last tranche from the US? And also, now that the mask mandate has basically been lifted, will the ministry be paying closer attention to the spread of the virus in the coming weeks to see if there may be any correlation to that? That's it for now. Thanks.
Yeah, thanks. So, Suan, as I said in response to your first question, when we got in the second tranche of 75,000, I indicated to the population back in February that we were told quite rightly by our friends in the United States that if we don't show an appetite for this first tranche, the chances of getting a second tranche are going to be significantly dimmed. So said, so done. So it is very unlikely that they will gift us any more vaccines to simply send it down here to be destroyed. It is better it goes to another country that has an appetite for the vaccination program. On whether we monitor, we monitor every single day. So we monitored before we lifted the mask mandate. We monitored after Christmas and New Year's when we were expecting a spike. We monitored after the Taste of Carnival. We monitored when we dropped the TT pass requirements and then the proof of vaccination. We monitored after those two large mass events, one in Brian Lara Stadium and one in Port of Spain. And we will continue to monitor after Sunday, the next 2 to 3 weeks. By the end of July into early August will give us some idea. And yes, our monitoring is ongoing. Okay, thank you very much.
Thank you, Minister. We go across or go back to Guardian Media for your follow-up question.
So for Minister or CMO, with the type of really weather we've been seeing and the Sahara dust, is there a lot of influenza going around, and what is the uptake of the influenza vaccine?
Yeah, so in terms of the influenza, we had one confirmed case of influenza recently. We are not within the influenza season at this point in time. It generally restarts in October and goes to around May of each year. Our influenza vaccines for the coming season, as you know, there are usually mutations even with the influenza virus from one season to the next. So the actual vaccine for this new season will be modified, and we will get those in usually in the first week of October thereabouts to begin our vaccination program for the 2022-23 immunization program for influenza. But we have picked up one unusual case in terms of influenza outside of that normal ban, and of course COVID would have a role to play in the way the season or the disease will fluctuate from an epidemiological perspective. Over the last 2.5 years, there would have been significant public health measures at play as well. So a lot of things would have changed in terms of the seasonality of influenza, and we have to keep a close eye on it. But the vaccine should come in as usual, and then we re-begin our vaccination program then.
Thank you, CMO. Just a question to you. What was the rate in the 21-22 season? How in terms of influenza?
The vaccination, yeah. So generally speaking, prior to COVID, we would have seen an increase in the number of influenza vaccines given out in the country, going to a peak of about 118,000 vaccines in the season just before COVID-19 came along. And as we saw with other vaccines, even in the childhood immunization suite, we basically saw a decrease in the uptake of the vaccine. So we would have hovered somewhere around 50,000, if I remember right, for the existing immunization, the last period of vaccination. So there was a drop in terms of the general uptake of influenza and other vaccines during COVID-19.
I'm sure that the cases went down in terms of
the cases declined significantly as well. And of course in no small order due to the public health measures that were in place, including masking.
Thank you, CMO. And with that, we go across to Newsday for a follow-up question.
Good morning, Paula Lindo here again. My question is to the CMO. We talked about how BA.5 is likely to reinfect people. Could you tell us about the status of the long COVID clinic and if we've seen more patients coming in since the last time we got an update? Thank you.
Yeah, so the status is really that the clinics continue. In terms of general ARIMA, there's a specific clinic dedicated for long COVID. In hospitals, other hospitals, they have been integrated into the internal medicine clinics to the most part. So not a great increase in the number of persons being seen in that clinic last time I spoke to the different RHAs, but certainly it is something that we will keep our eye on. As I said, the Omicron variant and even BA.5 hasn't been shown to have that level of severity increase. At least the data for now doesn't suggest an increase in severity and long-term outcome, but certainly an increase in the number of persons being infected. So in time will tell if that redounds to an increase in the number of persons with long COVID. So over time we will see if that trend, if there's an uptick related to Omicron or not. But for now we're not seeing that increase in the long COVID numbers.
Thank you very much. EZP News, your follow-up question, please.
Hi, thanks again. Minister, I know you may not be able to give a definite answer now, but how long do you think that, based on current data, will the mask mandate be implemented for the medical facilities?
So you are quite right. I can't give an answer now.
All right, thank you very much. If there are no, I see. Yes, I think Ms. Wayo has a follow-up question. We'll go back to you, Ms. Suan.
Yes, I do. This is unrelated to COVID-19, but given the flood situation that several areas of Trinidad are currently experiencing, what can the ministry do or is doing, assisting and advising with respect to that when it comes to food, illnesses, etc.? Thanks.
Yeah, so just to underscore, the Ministry of Health has launched its rainy season program quite a while ago. I think we had a discussion even on this program as it relates to tips, how to treat your vegetables and fruits post-flooding to avoid certain diseases, example, leptospirosis, dengue, and the lot and vector-borne diseases. So generally speaking, our guidance remains on the Ministry of Health's website, and our Public Health Inspectorate, manned by the CMOHs, are really the ones on the ground, and they liaise with the local arm of local government to ensure that any inspections that need to be done, and of course insect vector control plays a significant role in terms of monitoring and managing the vector population in the country. So it's a wide gamut of activities that are related to the rainy season as it relates to vector-borne disease, as well as foodborne illnesses and surveillance for those things, as well as managing from the Public Health Inspectorate. But we work closely with other agencies, knowing especially as it relates to severe flood-like events, the ministry is a second responder in terms of the response. Primary responders remain local government and ODPM, and we assist them in terms of the secondary response.
Thank you very much, CMO. And of course, there's significant information as well on our social media pages. We invite the public to go there to find information on rainy season tips for the public. I see that we have EZP News. Your hand is up. We're ready for your question.
Hi, yes, CMO, with a follow-up to what you just said, have you all gotten any reports of anything that raises a red flag or is cause of concern so far?
Not from an epidemiological perspective. We expect to see an increase in vector-borne diseases in the near future, but we haven't seen a significant increase as yet. As the rainy season goes onwards, we will be keeping an eye on the vector-borne diseases in particular. Things like foodborne illnesses tend to increase as well. So from a surveillance perspective, we will certainly be looking at those indices to see if they increase. And we saw significant decreases over the course of COVID-19 because of decreased mobility of people and, of course, increased hygiene measures and public health measures. So it's something that we are paying close attention to see if you see a rebound in vector-borne diseases and foodborne illnesses post-COVID-19 as well, and certainly related to the rainy season.
Thank you. CMO, we'll take a question from Newsday.
Actually, I think the CMO just answered my question, which was to ask if we had seen any increase in, say, dengue cases since the rainy season started.
Yeah, I just want to come in here and thank you for raising that, Paula. The CMO and I and a couple others were discussing the effects of lifting the mask mandate from Sunday, and what we are noticing is that many business places are doing away with the requirement for hand sanitizers or hand sanitizing with their wall-mounted units. If I could just make a plea to business owners and everywhere, whilst that was never compulsory, it was part of the 3 W's, wearing your mask, washing your hands, or sanitizing your hands. I think we would still like business places to keep on inviting your patrons to sanitize their hands on coming in. Let's not do away with that one completely as yet. It's not the law, but let's keep on inviting our patrons to sanitize our hands. The same way we are being very responsible with continuing the mask wearing. Let's still continue the basic 3 W's. Wearing your mask where appropriate, sanitizing your hands, washing your hands, or sanitizing and watching your distance. Those three recommendations are still fashionable and still, should still form part of our public health landscape and our behaviors for the time being, at least.
Thank you very much, Minister. Ladies and gentlemen, we have come to the end of today's media conference, and as we close, we want to emphasize that even though we have begun to roll back the restrictions, the COVID-19 virus is still among us. And please be vigilant, be responsible, and continue to protect yourself and your loved ones. We again remind the public that the COVID-19 vaccines are safe, they are effective, they are free, and available at all our health centers, all 109 across Trinidad and Tobago. And if you or your child or your teen haven't received the COVID-19 vaccine as yet, we encourage you to ensure that you all get vaccinated. We also invite you to visit the Ministry of Health's website at health.gov.tt and social media pages for accurate and up-to-date information, health information. Please be safe and goodbye for now.
Successful parenting through COVID-19.
Being at home with your child for a long time can feel stressful, especially when they misbehave. Children can also feel stressed as their routines have changed.
Manage negative behavior through creating schedules, planning indoor activities and outdoor activities, giving responsibilities, and rewarding good behavior. All children can be mischievous. You can discipline without